So, good evening to all the viewers. We at Osteoporosis and Arthritis Care welcomes you for this today's awareness program. Um, Today, our program is related to very prominent in this kind of era. Our event is sports injury and prevention, and with our distinguished guest, Dr. Divas Gupta. Dr. Divas Gupta from Yashoda Hospital, Ghaziabad. Dr. Divas Gupta is a consultant on orthopedics and excellent academically. Currently is an associate consultant in orthopedic department in Yashoda Hospital. And more than 500 surgeries already been done. More than 770 arthroscopy already been done. And doctor manages very complex trauma and emergency cases. And obviously, doctor is trained in tumor clinic, sports injury, and spine care. And doctor favorite topic, I think, very good in arthroplasty or advanced orthopedic techniques and trauma, obviously, and that is specialized. So, without any further delay, I like to call upon Dr. Divas Gupta to say upon the sports injury and prevention. So, over to you, Doctor.
Thank you, Mr. Sanyal. Hi, viewers. A very pleasant afternoon to you all. So, I have been assigned with the task to give a presentation on sports injury and its prevention. In this modern era, in the era of health influencer, when everyone is paying attention to their health in some or another way, some are going to the gym or some are doing some sport activity. So, it's very common that we see around 30 to 40% patient in our OPDs on a daily basis, which have suffered from any kind of sports injury. So I'll start the presentation now. Now moving on to how do you have a sports injury? The two common causes are trauma or overuse. Suppose we are playing some sport and we are overusing the overhead movement in like badminton. It can lead to the sports injury around the shoulder. Or very commonly runners or footballers, they have a sports injury around knee. So mainly trauma and overuse are the two causes. Now moving on, what symptoms do they have? The symptoms basically depend on what kind of injury is the patient having. Some, if there is a muscle torn, the injury is not so oblivious, and in case of knee dislocation or in case of a fracture, the pain is excruciating. So yeah, in most cases the pain gives us the first sign of injury. Moving on, what are the types of soft tissue injuries? So suppose we are looking at my arm. What all things my arm is composed of? First, it's skin. Then beneath that, it's subcutaneous tissue. Then beneath that, there are muscles and tendons, which are help moving the bones and joints. Beneath that, there is the hard tissues, joints, bone. So we'll talk firstly upon the soft tissue injury. Now, soft tissue injury commonly have muscle sprain, muscle strains. There may be bruises, there may be torn ligaments, and those tears may be as well partial or complete tears, tendon and ligament injury. Another kind of soft tissue injury which play a very important role is injuries around shoulder, like Bankart lesion. We can see slap lesions and we can see remplissage, in which a cuff of ligament gets erupted from the glenoid rim and the bone moves forward. So moving on to the hard tissue injuries, we can see any fracture related to the bone, or we can see joint dislocation or subluxation. Now moving forward, here are some common types of sports injury. We are going to talk about first, what is a sprain? A sprain, basically, first you have to talk about which structure is involved, is injured in the sprain. So the ligament is the commonly injured structure. Now, if there is any excessive movements and the range of motion is beyond the human limit, then there may be a ligament tear, which can be a partial tear or complete tear, depending upon the force. Like, for example, a football tackle, you get side push and can cause a ligament injury. Now, moving on to the muscle or tendon, the injury commonly which occur in muscle or tendon is strain, and again some tear in tendon. So, the overstretching of a muscle may be caused because of sudden acceleration or sudden decelerating movements can cause a tendon tear. For example, my fingers when it get pushed against a ball, like in many basketball players, so the flexor tendon or extensor tendon get injured because of the sudden deceleration pull. Moving on to the contusions. Contusion is basically a hematoma deposit in any form. Now, it can occur in muscle, it can occur in tendon, it can occur in skin. It's basically the deposition of blood, which is caused by a sudden force applying to the site. It causes the blood vessels to break up and it gets a deposition of blood and causing contusion. There may be open injuries like lacerations, abrasions. There may be a clear-cut wound that can be caused directly by the collision of player to player or player to equipment. Mainly, open wounds are seen when there is a high injury trauma or when there is a sharp object involved. Moving further, about hard tissue. So there are various type of fracture, even in a simple bone. Suppose consider humerus, the bone of my arm. Now it helps in forming two joints, elbow joint and shoulder joint. Now there can be periarticular fractures around elbow, there can be periarticular fractures around shoulder. There can be the fracture of the diaphysis. Now there are various fracture pattern as well. We can't even count how many pattern of fracture can occur in just a simple bone like humerus. And another thing about injuries to the joint is there may be a joint dislocation or subluxation. Now, what is dislocation and subluxation? We'll discuss it in the further slide. Okay. Now, moving on to classification of injuries. Now, if we classify sports injury, they can be mainly three types like acute injury, chronic injury, or overuse injury. Now, what acute injury? Acute injury occurs suddenly in an activity and it is further associated with pain, loss of function. There may be swelling as well, and there may be erythema around the site of trauma. So acute injuries are caused mainly by direct injury caused by an external force such as by collision between players and between the equipments. Suppose a ball hit my hand, it can cause a direct injury. There may be bruising, there may be fracture because of direct injury. Moving on to indirect injury, it can be caused by internal forces like overstretching of a ligament, like changing direction suddenly in a turnover of basketball, or suddenly when a player stops while running to catch a ball, there can be a tear in ligament in around the ankle as well, and it includes sprains, strains, and tear mainly. Moving further about chronic injury. Now, chronic injury tends to start as acute injury, but then they reoccur, and as a result of weakness to the injured side or insufficient rehab, it can occur over and over again. Now, on the right, there's a diagram showing the common site of overuse injury. Overuse injuries are caused by excessive and repeated use of the same muscle or bone. For example, on the right, there is written Osgood-Schlatter. Now, Osgood-Schlatter is a disease seen in the young adult population, in which the tibial tuberosity gets irritated because of over and over use. Moving further, injuries which that involve sorry injuries that involve the body tissue apart from bone classified as soft tissue injuries, although caused involved in each injury are different. Sprain in an injury that involve the ligament or tissues around a joint, such as ankle or wrist, and it can occur as a tear of a ligament as well. Now, for example, there is a joint between the two bones in our wrist called radius and ulna. There is a structure called as TFCC, triangular fibrocartilaginous. So there can be injury to TFCC as well, which can occur as a sprain. Now, a strain occurs away from a joint and involve a twisted or torn or overstretched muscle. Like you have heard, many cricketers have a hamstring strain, or the strain in the calf, or strain in the thigh or lower back. Moving, a bruise is a soft tissue. Sorry, a bruise is a soft tissue injury that involves the skin or subcutaneous tissue following a blow or other forces that break close to the surface of the body. Now, bruising may be seen with the sprain or strain as well. The color of the tissue changes. Like when there is a injury is fresh, there is a reddened tissue around the subcutaneous area, then which changes to the purple, and later on it can change to black and yellowish hue. And it is the various stages of the resorption of the blood. Now the symptoms and sign. Commonly after a sports injury, patient has a pain at the site of the injury. There may be the loss of the power in the injured area. Now here by the loss of the power, we mean the muscles are not able to exert their complete power. Like if we grade the power of the muscle, they are graded in 5 stages. Now, if there is not complete power, like the muscle can go this but not this, then this is called loss of power. There may be the swelling around the injured area. There may be nausea. There may be feeling of faintness or giddiness. And if there is an open injury or there is a hemorrhagic shock or some kind, It can be a cause the pale, cold, and clammy skin. Moving further, now we'll talk about another interesting topic, which is joint dislocation and subluxation. In modern form, everyone has seen a joint dislocation or subluxation somewhere or another. A recent video of a very famous cricketer, Rohit Sharma, was there, in which he used to relocate his shoulder automatically. Now, some people can do that, and he's a superman for that. But a joint dislocation case is a very painful case, and it's like a medical emergency. You have to treat the patient within next 15 to 20 minutes, because the amount of duration in which the joint is not in its normal place, the blood supply to the bone decreases. So, what do you mean by a dislocated joint? Joint dislocation means when the two bones which are in contact and forming the joint, they get completely separate. So this is called a joint dislocation, where the two bones that come together form the joint become separated. The most commonly dislocated joint is shoulder joint, elbow joints, and some joints of hand as well. Here, I would also like to talk about the subluxated joint. Now, the dislocation is complete separation of the two bones, whereas in the subluxation, there may be the partial contact between the two bones is left. So, like this bone, this is complete dislocation, but this is partial subluxation when some part of the contact between the joint is still there, like the joint congruency is still maintained somehow. Moving further, what is the fracture? A fracture is a break in the bone. In medical terms, we say the bone has multiple cortex. Cortex is the outer covering of the bone. When there is a crack in it, it's a fracture. Now, fractures can be acute fracture, which can be a simple clean break between the bone with a little damage to the surrounding tissue, or it can be a compound fracture in which the skin is the bone pierces the skin, and there is a lot of damage to the surrounding tissue. So, compound fracture is difficult to manage. There is difficult to treat, and the result after the treatment of compound fracture is slightly poor as compared to the clean fracture, simple fracture, or closed injury. There are also some type of fracture, like in runners, we see the some fracture in foot or some fractures in leg, just because of running, just because of the overuse. There is a gradual stress which increases over the time, and pain increases over the time. These are called stress fractures. Now we'll move to the prevention side. So for sports, injury can be prevented by looking at some factors such as the environment of the particular sports, protective equipment, and nutrition. Now the sports environment include something like weather. How's the weather? How are the sports facility? Whether you are playing in a stadium, whether you are in a swimming pool, whether you are playing in a playground. How is the surface? Whether it is rough, whether it is a smooth surface, whether it's a slippery surface or it's cemented or hard surface. What all equipments do you have to play? Do you have a proper protective gear or not? What is your level of fitness? Now suppose I am a lazy 30-year-old guy. If I suddenly imagine that I'll play a professional level hockey tomorrow, then I'll go. Then I'm very prone to injury. So you have a particular element of fitness to you, and before playing any sport, even before gymming, even before running as well, you have to do some proper stretching or proper warm up exercises. The fluid level and the electrolyte level you have in your body plays a ultimate and utmost role in preventing you from sports injury. Apart from that, what are the techniques and training do I have? Suppose I suddenly plan to climb a mountain. Like a recent documentary I saw about Nimsdai, he trained for it. His body was completely set in, and he was there's a word called acclimatization, that your body is acclimatized to the situation you have to face. So technique and training is important as well. Playing with injuries. Now we see, due to some important matches, some sports player play even in the injurious state, but get a proper check, get a proper clearance from the physician or orthopedician or a sports surgeon before getting back to the sports activity. And you should have proper protective equipment. I can't emphasize much on that point, that you should have a proper equipment. Now moving on, maintaining flexibility. Again, maintaining flexibility is that stretching and your warm-up exercise. It's extremely important that you do some dynamic stretches before you're starting off the activities. As I told you, you need the blood pumping up to your muscle, because the cold muscles are very prone to the injury. And you can start with simple jumping jacks. You can start with butt kicks. You can start with simple jog, standing at one place, or you can simple fall down and touch your toes. Give a gentle stretch to all the muscle involved. Like suppose I'm doing any upper body activity, like I'm starting to play a badminton, then my shoulder joint, my elbow joint, my wrist joint should be properly stretched before starting. Now strengthen your core. Can't emphasize that. Any gym trainer, any doctor, any surgeon will always tell you to strengthen your core. Now, what's the thing is we have multiple bones in our upper body. We have multiple bones in our lower body. But the area between our rib cage and the pelvis, this is called core, in which it consists of our abdomen and lower back. Now, a strong core improves the balance and stability in all the sports. And with a strong, with improved balance and stability, you can also avoid injuries. Now, what you can do to prevent, strengthen your core, there are some exercises to strengthen your abdominal muscles, like crunches, planks. There are various type of exercises, n number of exercises. If you are a gym goer, you can see to it. Okay, now here I'm not going to teach you the how to do plank or abdominal crunches, but you can look for the demonstration as well. It's very easy and you can do it. And even a beginner can do at least 5 to 6 crunches, the proper technique. After that, take time to rest. Playing any sport for too long without a break can cause muscles to be overused, which increase the chance of being injured. Now, sometimes there is a thing called lactic acid, which get accumulated in our muscle, which causes the pain and causes us to stop. But because of some motivation or some ego, you can play long hours without taking a break, which initially may seem okay, but after 2 or 3 days, when the muscle soreness onset occurs, then you think that the overuse injury can be occurred. Ensure proper healing of a previous injury. To avoid re-injuring yourself, check yourself with a doctor, physician. Again, orthopedician has your injury fully recovered, and are you fit to play the sports again? Thank you, everyone. Now I'm up for the questions. Anyone?
Yes, doctor. But so, yeah, I think rightly said by prank and all this exercise with right technique and all, because every day everyone is going for gym and all these things, and there can happen the sports injury or gym injury, something like that. I think you rightly pointed out you are a very good gym goer, I think, and you're healthier. Okay, it's required in your day-to-day life. Suggest one thing. Can you summarize something in Hindi so that in our other the major audience can take home some messages,
देखिए,
sprains and strains and all these things. Yes, yes.
एक छोटी सी बात मैं कहना चाहूंगा हिंदी के व्यूअर्स के लिए अपने, कि आज के डेट में जब सब लोग अपने हेल्थ पर, अपने फिटनेस पर बहुत ज्यादा ध्यान दे रहे हैं, जब सब लोग कसरत वगैरह कर रहे हैं, तो हमें ये भी ध्यान देना है कि अपनी हेल्थ को जब आप इम्प्रूव करने गए हो, तो उसको और खराब ना कर बैठे। तो उसके लिए सबसे जरूरी चीज ये है कि कोई भी एक्सरसाइज शुरू करने से पहले आपकी बॉडी का बेसिक तापमान जो है वो थोड़ा सा अप हो। आपका जो ब्लड सर्कुलेशन है, आपकी जो हार्ट रेट है, वो हल्की सी हायर लेवल पे पहुंचे। आपके हर मसल्स पे, आपकी पेरिफेरीज में, हर जगह पे वो ब्लड पंप करता रहे, ताकि जब एक बार रक्तचाप बढ़िया बन जाता है मांसपेशियों में, तो मांसपेशियों में जो ठंडक होती है वो कम होती है। मांसपेशी जैसी गर्म होना शुरू करती है, उसके बाद आप कोई भी एक्टिविटी करें, उसका आपको एक तो रिजल्ट भी बहुत अच्छा मिलेगा, दूसरा उससे आपके इंजरी के चांसेस भी बहुत कम होंगे। तीसरी चीज ये है कि बहुत बार हम लोग छोटी मोटी इंजरी समझ के इग्नोर कर देते हैं। जैसे बहुत से लोग जिम जाते हैं, सडनली एक दिन डंबल उठाया, बट डंबल उठाने के बाद आपका रिस्ट ट्विस्ट कर गया, आपने इग्नोर किया, आपने सोचा कि ऐसे ही कोई मांसपेशी खिंच गई होगी, मैं 2 3 दिन अपना घर पे वॉल्नी वगैरह लगाऊंगा, मैं ठीक हो जाऊंगा। बट ऐसा नहीं है। कभी भी अगर पेन आपका 2 दिन से ज्यादा लग रहा है, क्योंकि एक चीज होती है मसल सोरनेस, जब आप कोई भी मांसपेशियों से एक्टिविटी करवाते हैं, तो नॉर्मल है कि उसमें खिंचाव होगा, उसमें हल्का बहुत दर्द होता है। बट वो दर्द अगर 2 से 3 दिन से ज्यादा रह रहा है, तो प्रॉपर आपको एक ऑर्थोपेडिशियन को या एक प्रॉपर डॉक्टर चाहिए। क्योंकि बहुत सारी इंजरी ऐसी होती है, बहुत सारी चोट ऐसी होती है जो शुरू में बहुत छोटी चीज लग रही होती है, बट उसको इग्नोर करने से वो बहुत बढ़ जाती है। जैसे हम कितनी सारी महिलाओं में देखेंगे जिनका वजन ज्यादा होता है, 40 50 के एज पे, एक छोटा सा कभी ऐसा लगता है कि टेढ़ा पैर पड़ गया, सीढ़ी से उतरते टाइम घुटना हल्का सा लचक खा गया, बट बाद में पता चलता है उसमें अंदर जो घुटने के बीच में गद्दा होता है, मेनिस्कस, या फिर जो उसके आसपास के लिगामेंट होते हैं, वो फट जाता है। अब उसको उसी टाइम हम लोग ट्रीट कर दे आर्थ्रोस्कोपी या किसी भी चीज से, तो वो बहुत छोटी सी चीज होती है, वो बहुत जल्दी आप ठीक हो जाते हैं, 6 हफ्ते का ही उसमें रिकवरी पीरियड होता है। बट अगर आप उसी चीज को इग्नोर करते चलते हैं, तो आपका घुटना घिसने लगता है, धीरे धीरे आपको पता भी नहीं चलता, फिर बाद में वो चीज जाके घुटने का गठिया बन जाती है, और उसके लिए आपको इवन नी रिप्लेसमेंट तक कराना पड़ता है। हमारे ओपीडीज में ऐसे हम लोग बहुत केसेस देखते हैं जिसमें कि 40-50 ईयर की फीमेल आती है हमारे पास, बताती है डॉक्टर साहब हम तो किसी तीर्थ यात्रा पे गए थे, एक दिन ही ज्यादा चल लिए, उससे ऐसा क्या हो सकता है हमारे घुटने में, या फिर ये तो हल्का बहुत दर्द है, विक्स आयोडेक्स लगा के चला जाएगा। पर ऐसा नहीं है, एक बार अपना प्रॉपर टेस्ट कराना जरूरी है। ठीक है, तो स्वस्थ रहिए, मस्त रहिए, पर उसके साथ साथ अपनी हेल्थ पे ध्यान दीजिए प्रॉपर।
Thank you, Doc, for your lovely expression and this topic. एक कैसे हमारे इसमें ट्रीटमेंट क्या है? ये ट्रीटमेंट लॉन्ग टर्म है, क्योंकि अभी हम लोग ने फुटबॉल वर्ल्ड कप देखा, वहां पे तो सबसे ज्यादा इंजरीज है, स्पोर्ट्स इंजरीज है, बट वो लोग नेक्स्ट डे मैच खेल रहा है। तो इसका ट्रीटमेंट एंड ऑल दिस थिंग्स कैन यू हाईलाइट ऑन दिस, तो पेशेंट को डर ना लगे, यही।
देखिए, एक लेमैन के टर्म में मैं कहा जाए तो एक ऑर्थोपेडिक्स में प्रिंसिपल होता है प्राइस, PRICE। प्राइस की फुल फॉर्म होती है, पी से आता है पेन रिलीवर, आर से आता है रेस्ट, आई से आता है इमोबिलाइजेशन, सी से आता है कोल्ड फॉर्मेंटेशन, एंड ई से आता है प्रॉपर इवेल्युएशन। यानी कि कोई भी इंजरी होती है, आप ये बेसिक स्टेप हर इंजरी में फॉलो कर सकते हैं रिगार्डिंग कि आप कोई गेम खेल रहे हैं, स्पोर्ट्स खेल रहे हैं, उसमें कोई इंजरी होती है, जिसमें सबसे पहला पेन रिलीवर के लिए हम लोग कुछ एनसेड्स या नॉन स्टेरॉइडल एंटी इन्फ्लेमेटरी ड्रग्स होती है, जिसमें आपको पैरासीटामोल, ये जो कॉमन ड्रग्स हम देते हैं, पेन किलर जिनको कहा जाता है, ओवर द काउंटर जो लोग खरीद लेते हैं, उनका एक प्रॉपर तरीके से शुरू करा जाए। उसके बाद रेस्ट प्रॉपर लिया जाए, क्योंकि हर किसी को ये लगता है कि मैं एक्टिविटी कर रहा हूँ, मैंने जिम ज्वाइन किया, मेरा टाइम वेस्ट होगा, मैं अगर 2 दिन रेस्ट करूंगा मेरा फ्लो टूट जाएगा। पर नहीं, रेस्ट की एक अपनी इंपॉर्टेंस है, जब भी पेन होता है उसकी हमें रिस्पेक्ट करनी चाहिए, तभी वो ठीक होगा। उसके बाद इमोबिलाइजेशन, सपोज इस फिंगर में मेरे चोट लगी है, तो मुझे एक जॉइंट डिस्टल और एक जॉइंट पहले प्रॉक्सिमल, इन दोनों जॉइंट तक के स्पेस को मुझे मूव नहीं करना है। तो इसके लिए कोई स्प्लिंट हो गया, लोग बहुत बार क्रेप बैंडेज बांधते हैं, बहुत बार हमें कच्चा प्लास्टर लगाना पड़ता है, पक्का प्लास्टर लगाना पड़ता है, वो चीज करनी चाहिए। अब आती है बात कोल्ड कंप्रेशन की। एक और बहुत कॉमन डाउट रहता है लोगों के दिमाग में कि हमें कब गर्म पानी से सिकाई करनी है, कब हमें बर्फ से सिकाई करनी है। सो कोई भी जो स्पोर्ट्स इंजरी कॉमनली होती है हमें, उसमें नॉर्मली स्वेलिंग आती है, उस स्वेलिंग को कम करने के लिए हमेशा हमें आइस पैक को ही प्रेफर करना चाहिए, आइस पैक से सिकाई करनी चाहिए, जो कि हमें 30 to 45 सेकेंड्स तक लगाया, फिर 5 मिनट्स हटाया, फिर 30 to 45 सेकेंड लगाया, फिर हटाया, ऐसे 3-4 साइकिल किया हमने। उससे क्या होता है कि जो अंदर ब्लड वेसल फटी होती है और जो ब्लड एक्यूमुलेट हो रहा होता है, ब्रूजिंग हो रही होती है, वो डिक्रीज होती है और स्वेलिंग भी काफी हद तक कम होती है। तो ये सारे स्टेप्स हैं जो हम लोग फॉलो कर सकते हैं डे टू डे लाइफ में। एंड स्पोर्ट्स इंजरी में देखिए बहुत बड़ा स्पेक्ट्रम है। एक सिंपल से टेंडन पुल को भी हम स्पोर्ट्स इंजरी कहेंगे, और एक सिंपल वो एक जॉइंट डिसलोकेशन को भी हम स्पोर्ट्स इंजरी में का पार्ट मानते हैं। तो इसलिए बहुत इंपॉर्टेंट है कि आप प्रॉपर फिजियो या जो भी आपके आसपास है डॉक्टर, उनको एक बार एसेस करवाएं, कोई भी छोटी सी इंजरी को भी नजरअंदाज ना करें।
यस, थैंक यू डॉक्टर। आपने जो प्राइस बोला, इससे लर्निंग फॉर मी ऑल्सो। प्राइस हम सोचते हैं कि प्राइस मीन्स एमआरपी एंड ऑल दिस थिंग्स, बट यस, इमोबिलाइजेशन इज वन पार्ट दैट, वो सबसे बड़ा क्वालिटी ऑफ लाइफ को हैम्पर करता है इन आवर डे टू डे लाइफ। एंड घर पे भी देखते हैं, या नियर एंड डियर आवर्स को हम लोग देखते हैं कि क्वालिटी ऑफ लाइफ कैसे डिस्टर्ब होता है ड्यू टू इमोबिलाइजेशन। सो इट्स a great to hear you on sports injury. We'd love to take you on second part, your smiling face, on any other topic what you have liked, because this is one can thing that you can highlight our awareness in this in our AB Life program, sports injury and prevention, or another topic whatever you can think in 15 or 20 days after that. We can definitely, we like to take you in our channel, and your hardly 15-20 minutes, not more than that. So thank.
Particular parts like knee injuries are very common, shoulder injuries are
Knee
very
injury is very common. Yes, yes. Uh, Majorly for above 65 and 70, our father, mother, or grandmother, grandfather used to see like that. We definitely do take you through. So thank you, doctor. Thanks for coming here and share your thoughts on sports injury and prevention. And on the behalf of everyone in this AB Live program, osteoarthritis and OSTART is one of our channel name. We wish you on 80th Independence Day, as a proud Indian and a proud doctor. So thank you, doctor. Stay healthy, stay together, and definitely we'll get back to you and take you on another topic. Thank you, doctor.
you, Mr. Sanyal. Jai Hind.
Jai Hind.